And which disability benefits might you be eligible for if you have type 2 diabetes in the UK? Before we get into it, this video is for general information only, it's not personal advice. And for guidance specific to your situation, please speak to your GP, your diabetes team, or a qualified benefits advisor. Now, here's something a lot of people don't realise. Type 2 diabetes can be considered a disability under the Equality Act 2010, and that means you may be entitled to financial support you don't know about. But here's the key thing to understand. It's not the diagnosis that determines eligibility. It's how your condition affects your daily life. So the question isn't whether you have diabetes, it's what living with it actually looks like for you. Complications that can affect eligibility include diabetic neuropathy, which can cause pain, numbness, or problems with mobility. There's also diabetic retinopathy, which affects vision, kidney disease, cardiovascular disease, and severe hypoglycemic episodes, particularly if you've needed help from someone else during one. And it's worth knowing that the psychological impact of managing a long-term condition, including diabetes-related distress or depression, can also be relevant to a claim. So which benefits might be available? Personal Independence Payment, or PIP, is probably the most well-known. It looks at two things: your daily living activities and your mobility. To be eligible, you need to have experienced difficulties for at least 3 months, and those difficulties need to be expected to last at least 9 months more. PIP isn't means tested, so it doesn't matter what you earn or have in savings. If you're over state pension age, attendance allowance works along similar lines and is worth looking into instead. For those whose diabetes affects their ability to work, employment and support, allowance and universal credit with a health element are both options. These involve a work capability assessment, which looks at how your condition limits your capacity for work or work-related activity. Beyond these, other entitlements may apply. If you use insulin in England, you may be exempt from prescription charges. A blue badge may be available if your mobility is significantly affected. And if you're in employment but struggling, the Access to Work scheme can provide practical support. When it comes to applying, the strength of your claim depends heavily on the evidence you provide. Have an honest conversation with your GP, diabetes nurse, or consultant about how your condition affects your day-to-day life. Not just your blood glucose levels, but your mobility, your vision, your sleep, your mental health, and your ability to manage tasks independently. Ask whether they'd be willing to provide a supporting letter that describes your functional limitations, not just your diagnosis, and be specific about your worst days, not just your average ones. If your claim is refused, don't assume that's the end of the road. You have the right to request a mandatory reconsideration within 1 month of the decision. If that's unsuccessful, you can appeal to an independent tribunal. Many claims that are initially refused are overturned at appeal. To recap, having type 2 diabetes doesn't automatically qualify you for disability benefits, but complications and functional limitations may well do. The evidence you gather and the support of your healthcare team can make a real difference to the outcome. For up-to-date guidance on how to apply, visit Gov UK and Citizens Advice. We'll link to both in the description below. If you found this helpful, leave a comment, especially if there's something specific about managing diabetes you'd like us to cover. And if you haven't already, please like this video and subscribe to the Bolt Pharmacy channel for more straightforward health information.